Welcome to the Brain and Spine Neurosurgical Institute. Our goal at BSNI is fairly simple. We want you to have a thorough understanding of your condition. Patients often leave their doctor's office confused and with many questions. We want you to have an effective knowledge of your diagnosis and your course of treatment, so that together we can work as a team to address your concerns. Today, we are going to discuss the epidural steroid injection. Our visit starts with a thorough examination. Patients often present with pain, radiating down from their neck or back out into their arms or legs. This pain is often due to the compression of a nerve. Often, we can identify the source of this pain by looking at an MRI. Let us review what we see in an MRI. The spine is made up of a group of vertebrae, or small bones, stacked one on top of the other. These vertebrae are separated by cartilage, a spongy material that provides cushioning between the bones. In this particular picture, the vertebrae are brown and the cartilage is white. The vertebrae surround and protect the spinal cord, which is seen in yellow in this picture. The spinal cord is made up of a collection of nerves. The spinal cord is surrounded by fluid. This fluid is almost like a protective balloon. In this picture, we see the rapid progression of a herniated disc. The discs of cartilage between the vertebrae are constantly supporting our entire body weight. Over time, this pressure can result in one of these discs being forced out of place and into the spinal canal. As it continues to bulge, this disc may press against a spinal nerve. This compression often results in leg or arm pain. In this MRI, we can see that the patient has a relatively significant disc herniation that is pressing against the spinal column. How do we address such a specific location on the spinal cord? Using a fluoroscopy machine, we are able to produce live X-rays that help us direct our focus. Patients will lie face down on the table as we use these X-rays to carefully guide the needle to the inflamed nerve. This is almost painless as we administer an anesthetic around the site of the injection. Once the needle is in the right position, we will release the steroid right next to the nerve. The steroid will reduce the inflammation and reduce back pain. The procedure is short and lasts less than 5 to 10 minutes. However, the effect of the steroid is usually delayed, and it will be about 2 to 3 days before the patient has any relief. After the procedure, patients will need someone to drive them home, as temporary numbness in the legs is common. Hopefully, this will give you a better understanding of an epidural steroid injection. They are very safe and relatively effective. If you have any additional questions, please don't hesitate to ask.